So thank you, Mike, so much for taking the time out of your busy schedule to just chat with me today. I really appreciate it. I know that we've had an interesting journey thus far working Boston Scientific and Aptitude, and I'd like to just jump in here and get started.
Sounds good, Teresa. Thank you for having me. You're right. For many years, Boston Scientific pushed back against participating in the platform. And I think, like many suppliers, we were just concerned about the potential for any organization to get between us and our customers. But what we found over time is that more and more health systems are looking to companies like Aptitude to help with their value analysis, their RFP management, their ongoing contract performance. So it made sense for us to participate, especially in those business units where there's less uptake of the national agreement and more local programming. So since that time, we've been fully engaged within those business units.
Yeah, and it's been great. Let's talk a little bit about that journey that we've had together. Aptitude as this conduit between the supplier and the provider, and how we've developed this unique partnership, I think, that has really provided some value for both our mutual customer, the provider. So let's talk a little bit about that.
Absolutely. Yeah, I think where it works well is where we get all the stakeholders together at the table in advance of a sourcing event to talk about what's working currently, what changes we would make in order to make things work better in the future. And Aptitude has been a great collaborator when it comes to being a conduit for that type of communication. We appreciate that.
Yeah, I agree. We're working on identifying value early, right, for both the Boston Scientific or the supplier team and also for our providers. So, us having a lot of transparency, utilizing the platform, that's really worked well for us and for our teams, has it not?
Without a doubt, I think it gets back to that communication. In some
Mhm.
cases, we may receive an RFP that makes it hard for us to provide value. And sometimes we may provide value that makes it hard for one of our provider partners
Sure.
to actually access that value based on the structure of our response. And Aptitude has done a nice job. You and your team have done a nice job of really creating that communication, getting us back to the table to talk through how we can work together to provide that value.
Yeah, I agree. And, we've at times had to course correct. Why don't we talk a little bit about that, right? Sometimes things are going a little off the rails and we have to pull the teams together. So I think one of the things that we've done really well is establish a good relationship and a good rapport, which has then kind of trickled down to our teams.
Yeah, you're right, Teresa. There have been occasions where we may receive an RFP that is structured in a manner that makes it impossible for us to really provide value. And I know that's frustrating both for our local teams as well as the providers that you're working with. So
Sure.
when we get together, and your team has been great to get us all together to talk through, what the objectives are of the healthcare system, and talk more about our capabilities and how we can work together to match those up and create value for our mutual customers.
Let's talk a little bit about the best path to value for our mutual customer. When we've gotten everyone on the same side of the table has seemed to really provide value for both our provider and for the supplier. I know we've got a lot of examples where that has gone really well. What advice do you or would you give to any new maybe members accessing
Mhm.
the Aptitude platform or any new suppliers where we can develop that relationship with them?
Yeah, I would agree with you, first of all. As far as advice, I would say that I have an observation and then maybe a little bit of advice afterwards. And the observation is this, that when you look at all the parties that are involved in this healthcare ecosystem, the providers, the suppliers, the performance improvement companies like Aptitude, I think we're similarly situated, more so than maybe we realize. At Boston Scientific, we look to bring technologies forth that meet four objectives. They increase operational efficiencies, they improve outcomes, they enhance the patient experience, and they improve the financial health of our healthcare system partners. And when you think about that, that's exactly what every healthcare system is trying to achieve. So we are really similarly situated and can get on the same side of the table. The advice I would give is to engage early in the process, well before any current contracts are coming due to talk about what's working, what's not working, and changes that we can make in order to make sure that we're providing value moving forward and working together. I think that's where we have success. So that's my advice, is the importance of that proactive communication and getting all parties together at the table.
Yeah, and then that way we're able to be as transparent as possible, both with supplier and with the provider. We're able to be proactive in our approach, which we don't have to course correct as much once we've gotten on the same side of the table and everyone is really working together and aligned truly.
Mm-hmm. Without a doubt. It's where we have that communication well in advance and we really understand where the health system is trying to go, that we can sit down and have really meaningful conversations together. And aptitude plays an important role in that, in bringing the parties together to ensure communication.
So, Mike, I think we've really touched on some great points today. Is there one thing within the Aptitude platform or within the Aptitude relationship that the Boston Scientific team really can't live without? And if there is there one thing that you would guide a new supplier or provider on within the platform?
Yeah, Teresa, I honestly, I think it's the people. The platform is one thing, but you and your team make the difference. People do business with people. And when we have an opportunity to engage on a weekly basis to talk through current and future sourcing events, how current contracts are moving forward, I really think that makes a difference, because it does allow us to make sure that our communication remains high, both between Boston and Aptitude, but also between Boston and our customer. You and your team really make the difference there.
Well, thank you. And we really have appreciated that, the transparency, the ability to work proactively, how we've had the ability to course correct, identifying value for both the provider and for the supplier. So again, thank you so much, Mike, for this today. I really appreciate you taking the time for us to be together. And I really look forward to what, 2024 and beyond offers for both Aptitude, Boston Scientific, and our providers.
Likewise, Teresa, I want to thank you and your team for your continued support, and I look forward to more in 2024.
Excellent.